that's better. So as I've been introduced, my name is Gloria. I am from Malawi. I just realized that I didn't carry my shirt that says I'm from Malawi. I've been inviting everybody to come and visit Malawi because this study, I did it in Cholo. It was COVID time, and it was a stressful time because I was the head of the COVID treatment in the Cholo District Hospital. I was the only doctor. But Cholo is one of the tea growing areas where there is tea, and then you come to Mulanje Mountain, which is the third highest mountain in Africa. So that experience was wonderful, driving down alone and going to see the mountain. Until now, my mountain meditations, I see Mulanje Mountain, and I would like to invite you all to come and see Mulanje Mountain and Cholo. You will love it. So what we did is that postpartum psychosis is a severe mental health illness that affects women soon after delivery. As you can see the numbers, it's a fairly rare mental health condition, but in a country where we have 33 births per 1,000 people, this is not so rare. And this illness presents with a high risk of suicide and infanticide. And on top of that is that in our country, in Malawi, the survival of a child who's just been born is most of the times dependent on the mother. So if the mother is not around to take care of the child, most likely the child may not survive because the nutritional needs and the social needs of a child are mostly dependent on the mother. So we did a hospital review at the Zomba Mental Hospital, and we found that most women who were coming with bad outcomes, like who were relapsing and had poor clinical outcomes, were those who presented to the hospital later on. And this was because of some of the stigma that was happening in the primary healthcare centers, where people like healthcare workers, nurses, and clinic officers are the ones who are supposed to identify these women and refer them to the only mental health hospital where we treat severe mental health illnesses in Zomba. So during our literature review, we found that if you include lived experiences in mental health training, it is effective to reduce stigma, and also that helps to the healthcare workers to provide treatment to the people. So we made a video. So this video is a 10-minute video. It contains knowledge. So that is technical knowledge on how to identify and treat and refer postpartum psychosis. And it also contains a narration of a woman, her sister, who had an experience of postpartum psychosis. So this video is made in both English and Chichewa, the national language which the woman speaks. So I'm going to present to you the findings of the second part of a study that looked at exploring what healthcare workers thought about this video and how it impacted them. So just to give you a bit of a background, this video was done in study was done in two phases. We had the qualitative part where we did a before and after. We did a knowledge. We gave healthcare workers questionnaires to assess their knowledge and their attitudes before they watched the video. And then we also did the same thing 2 weeks after they watched the video. And we found out that there was an increase in knowledge 2 weeks after, and there was an improvement in attitudes, meaning that the negative attitudes that were there before they watched the videos, they had significantly decreased. So I'm going to present on the second phase, which is the qualitative part, where we had two focus group discussions. One focus group discussion that involved healthcare workers who had experience with treating postpartum psychosis. And we also had another focus group discussion that had healthcare workers with no experience with treating postpartum psychosis. So this is a picture of healthcare workers with experience for treating postpartum psychosis when we had our focus group discussion. So the data was analyzed using thematic analysis, and the participants were ranging from 20 to 50 nurses and clinic officers. Note that all of our healthcare workers that participated were those who were working in rural areas, the primary healthcare sector. So what transpired was that healthcare workers stated that they thought the video was useful to them. They stated that it was relevant to their day-to-day work, in a sense that what stood out is they said they now understood how the patient felt. So one healthcare worker actually said that it took them from thinking that it is something that happens, as patients come in, but they thought about postpartum psychosis from the way the patient felt. Like, what would a patient need? What would a woman need who's coming in with postpartum psychosis? And they thought it was a good way of increasing awareness for postpartum psychosis among healthcare workers, and they were willing to apply the knowledge that they had learned into their practice. But they also said that they were thinking that some of the challenges that they would face for them to apply this knowledge would be like lack of resources. This is ongoing in Malawi, where we have drug stockouts, and healthcare workers explained that it's not just for postpartum psychosis, but for all mental health conditions. We do have problems because less than 1% of the health budget goes to mental health, and drug stockouts, even for sedatives, are very prevalent, and mostly in the primary healthcare sector. So the healthcare workers were worried about that. And they also expressed how they felt not confident enough, not having enough skills to take care of people with postpartum psychosis. I'll read this as it was, because these healthcare workers state that even if you look at the period that people working in health centers had learning psychiatry, you see they only had a month or two in class learning that. And that's just a month or 2 weeks working at Zomba Mental Hospital for the practical, and we expect them to deliver appropriate care at the health facility. How do they do that? And this healthcare worker, who particularly said this, had been working in the health system for at least 7 years, and they thought they needed more continuous personal development, especially in mental health care. And they also expressed that some contextual challenges that they had faced as themselves, as healthcare workers, they felt they were part of this. Some of them had said that they did not investigate women who came in presenting with problems with maybe mood problems or behavior problems. They just thought, well, they just gave birth, they might have a nasty attitude, or they're just talkative. And then they also explained that in the communities around in Cholo, Mulanje, we have a tradition where birth and early childhood care is more sacred. So when anything happens, they usually say that andisempa, which means like there is something that has gone wrong that has brought like a bad aura upon this mother and this baby. So this is why they would want to first go to asinganga, who are traditional healers, or they would rather go first to prophets before they come to the hospital. So the healthcare workers thought we should disseminate this video to other community members. But that would need to put in additional information in the video to remove maybe the technical information from the video and make a separate video that can be disseminated in the community, so that communities should also know about this, and that there is care available for people who present with postpartum psychosis. And they also stated that they wanted more information for the video, especially for the healthcare workers who are working in very rural areas, who thought that what was said in the video was not available for them. What should they do? They thought we should add that video, and they did recommend it to other healthcare workers. So since we found that this video was acceptable and useful, we had planned to disseminate it to other healthcare workers and to help reduce stigma. So right now we have partnered with the Teaching and Learning Development Center at Kamuzu University of Health Sciences, so to try and find a way, as I've said, that there is not much funding for mental health, so we're trying to find a way on how to disseminate this video cost effectively to more healthcare workers. But we're going to use, most likely we're thinking about using WhatsApp. we're into discussing on how best we can do the pre and post and how to get feedback from that. Oh, just 1 minute. Okay, so I'd like to thank Dr. Emery and Dr. Kari, because these were my supervisors. This was my MPhil public mental health thesis. Rob and Dali, the ones who made the video. Warm Heart are the ones who are funding my training in psychiatry residency. I'm in 3rd year right now. Thank you.